Hi friend, Dr. Nancy Trimbley here, putting the power and knowledge of your health back in your hands. Remember, subscribe, it's free. Click that notification bell, you'll know when we have new videos posted, which is all the time. We're going to talk about shoulder problems. When a patient comes in to see me with a shoulder problem, very often they'll say, oh my gosh, do I have a rotator cuff? Do you think? Do I have to have surgery? Well, I'm going to tell you, not only does everybody have one rotator cuff, they have two rotator cuffs. The rotator cuff just happens to be the most famous part of the shoulder. It is 5 muscles that do a lot of the motion for your shoulder and actually attach right here. So there are times where the rotator cuff does need work. There are times where a rotator cuff does need physical therapy. There can be tears in the rotator cuff muscles. They might be minor tears. It might be major tears. You might get an MRI, which shows a labral tear. The labrum is just another part of the joint. So let me clear some things up for you. Not all shoulder pain is the end of the world, but it can feel like that because when the shoulder is misaligned, it affects everything you do every day. When your shoulder's misaligned, I find that it can also create some anxiety. I don't know why, but I felt that with my own shoulder injuries, and I've noticed that with other people. So just calm yourself down. Let's talk about it. The shoulder is the most complicated joint. It's a ball and socket joint that has full 180-degree motion. And the other thing about it is that the only bony connection of your whole shoulder girdle, the only bony connection, meaning a bony joint, is right here where the clavicle meets the sternum. That's the only spot. Otherwise, it is connected by muscle and soft tissue. So it makes it very susceptible to misalignment. When you come in to see me, whether you've already had a shoulder surgery, whether you've already had a manipulation under anesthesia, that sounds bad, whether you've already been to physical therapy 1 time, 2 times, maybe 3 courses of physical therapy, I'm going to check the alignment. I'm also going to check the muscles to make sure there's no spasming. A lot of times there is, but I'm going to tell you, if the ball and socket joint is out of alignment, if the scapula is out of alignment, if the clavicle is out of alignment, the muscles are not connecting properly and they will start to tighten. Some of those muscles happen to be some of the rotator cuff muscles. The adjustments on the shoulder are super simple, and very often I notice from patients report to me that they feel immediately better, that they have immediate differences in range of motion. I also want to refer you to another video that we have called Simple Shoulder Stretches. That video will show you some simple stretches. Seems so simple they could be ineffective, but they're going to be safe for your shoulder. What I find is very often you go to physical therapy and they're having you doing strengthening when the shoulder's not even in the right place. And as I said, the muscles can't work properly if the joint is not in the right place. So, to be clear and logical, let's get it aligned first. Let's work on the muscles, and then let's strengthen. So, if you have any questions, as always, you can contact me and leave a comment below. Putting the power and knowledge of your health back in your hands. Bye for now.